but the reason I wanted to bring out pain as the first one is because it's misexplained by medical professionals all around the world, and it doesn't need to be as difficult as they make it out to be. So unfortunately, you get to deal with my mug. So I'm Josh. For those who haven't actually met me, a little bit of background about me. I've competed in powerlifting fairly recently. Nowhere nowhere competitive by any stretch of the imagination for my weight class, but enjoyed it, had some fun. Train a little bit more hypertrophy at the moment, but my background as a youth athlete, I was a national level swimmer in butterfly, and I was a national cricketer as well. I played for New South Wales in junior grades as well. Played pretty much every sport under the sun. It's fair to say that in all of that, I got a fair amount of injuries, and I've had three shoulder reconstructions on this shoulder, on my right shoulder. I've got no ACL in a knee. I've broken both ankles, crushed bones, everything. Um, Spent most of my life. I'm 29 years old now, and since I was 5 years old, 6 years old, I've been in and out of physio clinics. So I've got my fair share of experience firsthand of what's good, what's not good. And that has shaped, firstly, how I even got to being in the health and fitness space, even as a trainer, and then as a physio as well. And one of the things that I pride myself on is my ability, one, to explain difficult concepts and confusing concepts to some people, but also then to provide people with frameworks and plans to get them from a position where they're feeling that pain, that discomfort, that whatever it may be, that thing that's hindering their performance, and being able to bridge that with their coaches to getting them back to being as pain-free as possible and improving their performance. This is just a real cool action shot that I found out of Proform, but out of our Proform databases, but our entire clinic was actually founded in a CrossFit gym. So at the very core of our business is movement and exercise and being fit and being active, and not telling people to rest, and not allowing people to feel like that's the only answer, and giving people movement solutions, options, things like that, to be able to continue to do something while they are rehabbing an injury or while they are working around a dysfunction. So I've got here a little Venn diagram, right? And this is kind of to illustrate a bit of a point that I have, and a bit of a bee in my bonnet that I have with how I guess there's a hierarchy, and there's this perceived hierarchy of where everybody fits in this whole landscape of injuries, of like involving medical or healthcare or anything like that, where they have doctors at the top of this food chain, and then like say it's allied health, like myself, physios, chiros, whatever osteos you go to, then you have coaches and athletes underneath. And while that can be helpful at times with potentially things like surgeries, things like that, obviously surgeons have exceptional amounts of training and education, but I think it takes away from the fact that there needs to be a collaborative approach. And without that collaboration, everybody is bringing their own unique goals or their own personal goals, whether that's as a client. I know I have my own coach still to this day, and me and my coach talk about this all the time. Is every time I go see one of the guys at Proform for my own treatment, because obviously got a car crash of amount of injuries, I get them to still message my coach and let them know, let my coach know what they've found. And that's that collaboration that then helps my coach write a good program. It helps us all stay on track. It helps if I was to decide somewhere down the line this year that I wanted to jump on a powerlifting platform again one more time, and because I've missed it, then it means that we all understand where we're going to go and what we're doing and what each other's roles are. And there's no, oh, my physio said I have a torn this, when actually the physio never said that. And it's a really common thing, or like vice versa, it could be a doctor. Maybe a doctor has told you that you've torn a muscle, and then you go to a physio and your physio says, no, you haven't. Or your coach even might say, no, because if you had torn that muscle, you probably wouldn't be squatting 4 plates. And I've seen that as well. I've seen doctors call me, and I've had doctors call me and say, oh, this patient I'm sending you has torn their quad. But I actually go outside, I treat inside a gym. and I see the client out in the gym squatting 4 plates for reps. It's like, well, one of those two things isn't happening. All of that's to say that this kind of Venn diagram where we have this little point in the middle here where my mouse is, I don't know if you guys can see that, but there's this little intersection where the physio, the coach, and the athlete all intersect. And I think that's where healthcare doesn't meet and come down to that point, and healthcare practitioners by and large aren't willing to actually give up some of their authority, and they speak from these mountaintops and go, well, this is what I say, this is what has to happen, without considering what the coach's perspective is from a programming perspective, or understanding their client, or what the athlete or the client's perspective is and what their goals are. Like it's very easy for me to sit here and assume that everybody wants to do X, Y, Z. It's very easy for your coach to assume that too. Without listing out those goals, without understanding those things, then nothing can be done. So collaboration is key in all of these things. By the time I've got through all these next slides, is like that if you're a lifter who just loves training, right? And you're struggling with niggles, injuries, anything like that, then I hope that this is a catalyst and can be a catalyst for you to finally understand what's going on, understand whether it is like true pain or something to be worried about, and conquer that recovery and get to a point where you can then improve your performance. Um, Too many times we sit with injuries, we sit with niggles that just don't need to be affecting us for as long as they do. And it's just about having those quick little checkpoints with yourself, being able to understand those, and then if need be, being able to reach out to somebody who knows what they're doing, whether that's your coach or whether that's somebody like myself. Those are going to be the game changers for you guys. All right. So when we're dealing with these kinds of issues and we're talking about pain and things like that, it's always important to understand where uh what the outcome is, what the dream outcome is. And I think it's fair to say for most people I've worked with in my career, most people just want to feel confident in their bodies, feel like they're at peace with what's happening, like they're not anxious about, oh, is my shoulder going to hold up today? Is my knee going to flare up? Is my ankle okay? Like, do I have enough ankle range for my squat? Like, do I have enough shoulder range to do my pull-ups, whatever? And to be able to keep training if there is some soreness, even in the presence of that, and be able to keep going. We think that pain equals tissue damage? Like, do we think that pain is an injury by and large? Like, you can fire up the chat, you can unmute yourselves. I don't mind. Give me something to talk
I'm
about.
I'm going to point at Fuzzy. Fuzzy, if you're listening to this, unmute yourself and share a bit of thought here.
Hey, I guess thanks, Dennis, for throwing me on the bus.
That's all right, mate.
Yeah, I think 3 weeks into our prep for this comp, I messaged you about a shoulder, sort of like pain around the shoulder, and I was like telling you I don't know if I can do this because I feel like I'm gonna tear my pec. And then a week later, we started working on sort of perfecting my technique, and somehow the pain just went away for some reason, and then we just continued on prepping. Turns out it wasn't really injuries. I think it's just me moving the load in a sort of incorrect way, if you want to call that, or inefficient. Yeah.
Yeah. No, that's cool. Because like that kind of highlights my exact point. Like I skipped over the slide there because my fat finger was in the way, but like pain isn't always going to be that tissue damage. Like it depends on where that pain's coming from. It depends on the source. Sometimes that pain can come from, in your case, Dan, like you've got like technique issues, right? Like maybe you're not actually being able to, I'm assuming this was in bench press, yeah?
Yeah. Bench press. Yeah.
Yeah. So like maybe there's a little bit of retraction, a little bit of bar path, things like that, where it's putting undue stress on the front of the shoulder, things like that. Potentially even in like a squat, right? You might feel like your knees are getting really jacked up because your ankles aren't all that great. To what degree ankle mobility is like a real problem, we'll leave that for another time. But potentially even hip mobility or core stability, things like that. So it depends on the source. So not all pain is created equal. And this is actually from the International Association for the Study of Pain. Now, it's a massive mouthful, but the reason that they actually created this association was because there is just um, so much that we don't understand about pain. And the best definition that we have for it is that pain is an unpleasant sensory and emotional experience associated with or resembling that associated with actual or potential tissue damage. Really wordy way to say that there's pain is a sensation and an emotion. Yeah. So there's not just that feeling for Dan in that instance of his bench press. There's not just that instant of, oh, my pec feels tight. There's also that instant of, oh, I feel like I'm going to tear my pec, and then there's that worry, that concern of, can I even do this prep? Yeah, so like that's where the sensation and then the emotion kind of play into each other. And that comes from all of these factors, right? So you've got your pain experience in the middle here, and you've got a whole bunch of psychological factors. Like you've got the control, like that could even like perceived control right there could be like, this is like to the point of, can I control this weight in my hands in this bench press instance? No, no, I'm harping on this, Dan. So sorry, you've been thrown under
Yeah,
the
that's
bus
all
by Dennis. So you copped one there. But then it can then be amplified by these things like this hypervigilance. So being super mindful, super cautious around that. And then as we know, like if you're too hesitant with some of the things that we do in the gym, like you can actually end up making it worse for yourself because you start thinking about where it's sore rather than thinking about executing with good technique.
right.
Then you've got social factors, right? Like you've got things like, and I actually put this one in here on purpose, skepticism. So that's a weird one, right? Like you don't expect that to be social, but like skepticism is like, sometimes your friends don't necessarily understand why you actually lift heavy weights. They don't get it. Or even skepticism around whether or not you're doing the right thing, and these kinds of like negative cycles that you can find yourself into. And then we've got the more obvious ones, which is what people mostly associate with pain, which is these biological factors, where you're looking at the tissue health, like which plays from recovery and nutrition, hydration, all of those kinds of things. You're looking at the overall tissue quality, whether or not you have underlying pre-existing injuries or anything like that. And then you have neurochemistry and physiology, which play into these kinds of the sensations and the emotions and the hormones and the chemicals that are released by the body in times of stress, which training is a stress, not just whether or not your wife or your partner's yelled at you that day. Stress is also whether or not you've trained that day, or whether or not you've worked or had enough sleep, all of those kinds of things. And they can all play in and impact on that pain experience. It's a lot of talking to essentially summarize with this slide of pain is not necessarily tissue damage. So that little equal sign with a line cross through it just means it doesn't equal. So pain doesn't equal tissue damage. All right. The most important thing we can do with all injuries, all pain experiences, first and foremost, it's not that it's not pain. So there's a lot of things, and I think it was touched on earlier where like, oh, you're not in pain, you're fine. I think it was Tiff who said that. It's like you're not in pain, you're fine. It's like, well, no, you're experiencing pain, and pain is a sensation and an emotion. No one else can tell you whether or not that's real or not for you because it's your experience. The key when you've noticed that, when you've felt that pain, is to know and to understand that that doesn't necessarily mean that there is a damaged tissue involved, or that there is this site of an injury. So another way to say this is pain doesn't necessarily equal injury, would be another way to word this. And then it's really important in that we find, as we're working through the rehab process, we find that minimum effective dose of where our training can still sit. Because if we throw the baby out with the bathwater and we just don't train at all, 9 times out of 10, you might actually make it worse, because your body actually feeds off that movement and needs that stimulation to actually have the ability to repair itself. So it's about finding where that minimum dose is, where you're not in too much pain. Now, the research tells us that that's somewhere on a scale of 1 to 10, that's somewhere around a 4 to 5. Um, I don't know about you guys. I'm a bit more cavalier in that, and I'm happy to kind of sit at around a 6 out of 10, depending on what the pain is and depending on what the event is or what the sport is, and obviously depending on when it is in terms of competition, if there is a competition end date. But the research says a general safe space is about anything around a 4 or a 5 out of 10 or less is okay and acceptable in terms of dosage of training to be able to continue to train while we are rehabbing and working through these kinds of injuries. So I've jumped the gun, but yes, it is safe to train with pain, depending on the type of pain. If you have had a MRI and you have a complete tear in your quad, you're probably not going to be safe to do legs. Probably not, or probably not safe to run a 5K because there's a torn muscle, there's a significant tear in a muscle, might need a little bit of time to rest, recover, heal, so that you can then rehab appropriately. Otherwise, you're dragging one leg behind you like you're running out of the movie Gallipoli or something like that. Like that's just probably not ideal for what you're looking at doing. All right, so I've gone ahead and created this kind of slide. And guys, if you guys find interest in this, I can actually share these as a PDF to Dennis later, and you guys can all have these as a bit of reference point as well. But there's a difference between that discomfort and then that actual damage. Okay, so when we're talking about like categorizing perception of pain and categorizing whether it's true pain from an injury or true pain that's coming from more those technique-based things from Dan's content application from a bench press. There's these kinds of categorizations that actually really help delineate which one's which and differentiate whether it's discomfort or damage. And the two ones that I actually go with most are actually these two at the top here for discomfort. If someone comes to me and goes, "Oh, my shoulder hurts," but then tells me that it gets better as the session goes on, or that it goes away and it comes and goes, then it tends to be indicating more about it being a discomfort and potentially more of a technique-based thing or a movement efficiency-based thing rather than a true damage. I can actually use this example. I was treating a bodybuilder this afternoon, and she's been having pain with lateral raises for a while. And I asked her that exact question. I'm like, does movement help? And she's like, well, now that you think about it, yeah, movement, like as I do my session, it gets better. Hurts in the first few sets, but by the end of the session, it goes away and it doesn't stay with me all day, every day. I was like, okay, so we're looking more down discomfort for her. Whereas I also treated a client 2 days ago who came to me with a Achilles tendon issue, where on this damage side of things, he's a 65-year-old guy who's getting back into track and field competition, and training actually irritates it. And it's swollen and it's sensitive, doesn't wake him up at night, but it's swollen, stiff, sensitive that lingers when it does come on. So we're looking down the rabbit hole of, okay, well, potentially you actually need to go get this looked at a little bit more. And this is just a really cool reference point. And the reason I created this reference is because it actually helps. It helps people. Like I get DMs every day about, oh, like what do I do about this? What do I do about this injury? How do I fix this? So I actually I was writing this out and typing this out all the time. So now that I've got this slide, this is the slide and this is the image I'll send people. It's like if it ticks more boxes on the discomfort side of that screen, then okay, well maybe we'll look at it, but it's less likely to be something that's going to negatively affect your training or cause any significant issues or stress or damage, anything like that. It's just something we're going to have to modify your training around and work around as we go through. Whereas if it's the damage and it ticks more boxes on that side, okay, maybe we need to get that looked at and we need to take it a little bit more seriously. Okay, that all comes down to load management. And I'm sure, guys, your coaches have discussed this with you in the past, is like load management is ultimately the name of any type of rehab game. Okay, whether that's reducing percentage on the bar or weight on the bar, whether that's reducing number of sets, reps, volume, in more extreme cases, to Tiff's point earlier, maybe a deload is actually called for sometimes. It's very dependent, it's very context dependent. But at the end of the day, load management is what will actually determine whether or not the rehab process is successful and whether or not the rehab process is done well, because you can load manage too much and you can load manage to the extreme of reactive all or nothing deloads when maybe it's not actually necessary, and it could actually just be, oh, let's just change your technique slightly in that one movement at the start of your workout, and all of a sudden the rest of your workout's all peachy. So It's a real cool question, and this is a fun one. How can I reduce my pain or injury risk? And I get this question every single time I see a new client in clinic. Every time, every second DM I get is, how do I get out of pain? How do I not get hurt? And a warm up helps, okay? But, and I'll go through the warm up in a sec, you can't always you can't always protect yourself from getting hurt. We're throwing barbells around, we're lifting weights, we're trying to be strong, we're pushing the ends of our strength, our cardiovascular fitness, our ability to jump over stuff. Sorry, Louis, you're right in the middle of my screen, so I'm throwing CrossFit under the bus a little bit here. But our ability to do crazy stuff, right? So there's always going to be a risk associated with anything we do that's hard, that's challenging. It's also what makes all of our sports, all of our endeavors so fun. So we can't prevent all injuries, but what we can do is work to reduce the risk of those things occurring. But the anatomy of a good warm up and working through a well-structured warm up is really key. Step number one is get warm. No joke there. Like, funny that. Because warm muscles, we have good research that a warmer core temperature, a slightly elevated core temperature, actually improves the compliance of our muscles. Muscles are elastic. So the way I kind of describe it is like, if you've got like a actual cable, like if I use this cable, right? This is the cable for my microphone, not really elastic, right? Like that would be a muscle early morning, just rolled out of bed in the middle of winter, haven't done a warm up, and you just go in and try and throw 60 kilos over your head. Doesn't really work like that. Versus having maybe, like, if you've done a 5-minute warm up, like the recommendation is just moving around. That can be, excuse me, that can be as simple as just walking around the house aimlessly as you're making your coffee in the morning before you go, or when you get home from work, or when you just roll into the gym, just walk around a little bit, move, get through some movements, get a little bit of heart rate elevation happening. If you work a desk job, likelihood is you haven't really moved other than go to the toilet all day. I know I'm guilty of this a lot as well. There's days where I'm so busy that I'm just sitting on my chair in my treatment room, and I look at my watch at 6 o'clock at night, and I've done 1,000 steps for the day. And then I have to go try and train. It's like, oh, that's not going to happen. Like, I need to get moving. I need to get warm. I need to get some blood flow happening, because our blood, and it's not blood flow from, oh yeah, I'm just going to get blood flow happening. Blood supplies oxygen, supplies all of the nutrients that you need to do any exercise, whether that's a bench press, whether that's a snatch, whether that's, uh, sorry, I'm going to butcher this, dumbbell snatches, like something like, like anything that you do or anything that you have listed out in your workout needs that blood flow, needs that nutrient supply. So getting warm is really key, getting that kind of warmth to those muscles to get them more compliant. Once you've got that body temperature starting to elevate, you can start looking at your mobility stuff. And a lot of people get this backwards, and they'll do the mobility stuff before they get warm. And again, like I said, with the muscles being compliant, it might not necessarily be the best idea, because you can't always guarantee that you're going to be able to unlock those extra bits of range of motion, or the access to those ranges of motion, or at worst, test where you're sitting and where you're at. Some days your ankles might be really good. I know for me, my left ankle has some days where it's really good, but I also know that I fractured my ankle when I was 7 years old. And there's some days, especially in winter, where it's really bad. And those are the days where, unfortunately for me, squatting just isn't an option, because it's going to create other issues in my technique that just aren't going to make it optimal for me for that day. And that's why I do this. I test my mobility, test whether my ankles can cop it, test whether my shoulder could cop it with my pec, right? I did chest this morning. Didn't go that well. That's just is what it is with when you're working around injuries and working around structure.
Hey, Josh.
Yeah, hit me.
Are you okay with some questions, sort of, as we go?
Yeah, we can chuck some in now. Yeah.
Just very easy, like back on the previous slide where you said warm up, sort of thing.
Yep.
Get warm, Would you suggest this to people who are training earlier in the day more than those who are training later in the day?
Depending on job, depending on occupation, yeah. Depending on what else you do in terms of activity, yeah, I would. I think if you've got a guy, let's go, one of my clients this afternoon, he's a chippy. He's a carpenter, came in after a big day. Probably, and he was going to train after he saw me. probably doesn't need to do too much warming up because he's been walking around a massive job site all day.
Yeah.
Whereas I also rolled out of bed at 5 a.m. this morning to go train to get a lift in. So I had to definitely prioritize this a little bit more. In winter, obviously, as well, a little bit more important as well because it's freezing damn cold in Sydney. So, you kind of need to focus on that a little bit more, provided that all these other things are in check. Yeah.
Yeah, cool.
Cool. So that's getting mobile. So getting mobile isn't just about doing your ankle range of motion, your dorsiflexion things that your physio told you. Getting through like muscles and improving the tone around muscles. So simple static stretching can help here. Trigger balls and foam rolling can help. Okay, because what they do is they actually play on the central nervous system. They play on the brain, and they give you the perception of having an improved range of motion, an improved mobility. A trigger ball to the calf is one of the best things that I ever started giving out to my clients to help them feel like they had more ankle range of motion than they actually did. Doesn't necessarily change your mobility, but it improves your mobility relative to the task that you're about to do. And then we go back to these perturbations and all of that kind of stuff. And this is that slide that had all the videos on it. Getting primed. Now, this doesn't necessarily have to be those weird drills. Okay, I promise you, I'm not going to make people do those things all the time. There is a time and a place for them, and they are very beneficial, but they're not for everyone. And this priming can actually be, and I've used the word perturbations here, but this priming can actually be around tendons as well. I'm sure every lifter on this call has had some sort of knee pain at some stage in their lifting life. And there's isometric holds when done well. And that's not talking about wall sits, because I think they're the biggest waste of time. But isometric holds when you're in static positions, if we use a weightlifting example, if you're in the middle of, like, say, halfway down a split lunge or in a jerk position, you can actually hold some heavy isometrics there and create some sort of tendon priming in that particular position, where if you were to just go straight into lifting, you might actually start to experience some pain early on. For our power lifters on the call, this can actually be, it's a weird one, but it can actually be doing a lot of isometric stuff around the hamstring. We know that the hamstring has a great protective mechanism around the knee joint. And a lot of the time we focus on the front of the knee when we present with knee pain, and we neglect what the hamstring actually does and the hamstring's role in stabilizing the knee joint. So that's another example for the tendon. And then you go through the preflexes kind of stuff. So this is when we talk about preflexes, obviously we know what a reflex is. You sit at the doctor's office and they get the little tendons stick out and they hit your knee and, yeah, okay, cool, you don't have a spinal cord injury. Preflexes are actually things that happen outside of your conscious control, but they're the body's way of organizing itself to coordinate stability, and coordinate stability with respect to reacting to injuries, reacting to changes in environment. All these kinds of factors play an effect. So we use things like aquabags, the chaos ball. It's a little blue ball. It was in one of the videos. I'm pretty sure it was in Ricky's video. And we use those things to create that extra perturbation to the environment beyond what a controlled cable external rotation will do, anything like that. And then we got to get moving. All right. We get better at lifting by lifting. So the goal of warming up is not to be really good at warming up. The goal of getting warm, the goal of preparing to lift is to actually get us the maximum amount of time possible to lift. Now, this involves getting really good at doing productive warm-up sets, not just doing warm-up sets for the sake of doing them or just ticking a box. There's intent that's involved in that. There is the environment even can make a big impact there, like getting yourself in the right headspace to lift, to do these warm-up sets, and not just half-assing the easier or lighter sets. Part practice is key in there as well. So you've got like your snatch presses, you've got your W raises, tempo bench for a power lifter, pause squats, positional related things that improve technique. So this is all about the technique modifications. Once you've warmed up well, these technique modifications are more effective because you've got a system, you've got a body that is more compliant and more likely to absorb these kinds of things and learn and be in that appropriate learning state. All right, Because the goal with all of this kind of stuff, the goal with getting moving, the goal with warming up appropriately, getting warm, and then increasing these perturbations, and then training well and getting better at lifting by lifting well, is to reduce this concept of muscle slack, which is just having muscles that aren't actually in a position to exert a force. Doesn't matter whether it's as more like in a squat. Like I mentioned, your quads do a lot of work, but your hamstrings also work as well to stabilize the knee. So taking up that muscle slack in the hamstring, really important. Or it could be as simple as building tension. So it's being able to, if you're going through a WOD and you're doing dumbbell snatches, instead of having your arm come up and then just have this massive absorption through your shoulder, having a stiff shoulder, rock solid shoulder that catches that load instead of being thrown around is really key. All right. And then finally, for this, the most important thing you can actually do is actually just be honest with your coach. Okay. Like we've had it a couple times there. We had it brought up. It's like it's not something that you should be scared of, especially with the coaches here at Robo. They're not gonna tell you that it's all in your head and that you're faking it or anything crazy like that. But you need to be honest and you need to be able to take note of how you're feeling and tell yourself that you are actually understanding it and you are actually experiencing it. Sometimes we get so laser focused on the goal of whatever that day is, whether that's your last session before comp as a powerlifter, or whether you're, getting ready for the open or whatever. You're just going to go through it. You're just going to do it anyway. You're just going to rub more deep heat on it and hope for the best. But be honest with yourself. Understand that you need to take note of how your body's feeling, because at the end of the day, your coaches won't be able to help you and you won't be able to help yourself if you don't take note of, whether it's pain, whether it's you just feel sluggish, stiff, tight, where that is. And then try some of those things around the getting mobile, getting warm, trying some of those perturbations, of those co-contractions, getting stiff, getting those tendons firing. If those things don't work, or they do work, awesome. But then you, again, like I said, you need to talk to your coach. Coaches can't change what they don't know. And they don't know how you're feeling until you tell them. And that's the most important thing in all of this. It's not about me in all of this. It's not about me sprouting words. No one's a mind reader and we can't change what we don't know. So talking to your coach early, if that happens to be, in a warm-up set even, it's like, hey, I'm not feeling right. It's like, okay, we modify, we change. The coaches, any good coach will have contingencies in place if something's not going well, or if something's not going right. Okay. They'll manage the load so you don't get hurt. And then because I'm a real good guy, they'll involve a physio if needed. And whether that's me or whether that's potentially something where you need someone who's in person as well. If you're not local, the guys here will ask me questions and I'll be able to help triage and help determine what the best course of action might be. So again, cute little summary slide. This one I really just made because I wanted to give you guys something to actually take home after all of this, with all of these key points. All right. So getting warm, getting mobile, get primed, get moving, get honest, and get talking. I talk a lot on the internet, but I do like very simple things, and that slide just sums it up. Because realistically, 95% of your pain can actually more or less be, if not completely alleviated by technique changes and communicating those kinds of things with your coach. Sometimes it can even just be as simple as this and warming up. And the pain might not actually be a pain from a tissue. It might just be pain from being in a less than ideal position for a little bit too long in your workout.